It is a gorgeous day again in San Diego in Southern California at ACC 2015. We always get some really interesting late-breaking clinical trials. This is one of those. It is being simultaneously published in JACC, and it is perioperative results and complications in 15,964 transcatheter aortic valve implantations from the German Aortic Valve Registry, or Gary. And I am not with Gary, I'm with Thomas Walther, who is an MD, PhD, head of cardiac surgery at the Kerckhoff Heartcenter in Bad Nauheim, Germany. Tell me about the registry that you call Gary.
Gary Registry is an all-comers registry in Germany, and we try to include all patients who receive aortic valve treatments. This includes conventional surgeries and transcatheter aortic valve implantations. And specifically, we now looked at transcatheter aortic valve implantation outcomes here in this study.
Almost 16,000 patients. This is a big. I remember your first ESC that I went to that you had Gary presentations was about 2 or 3 years ago, I think.
Yes.
And very good data then. What are you publishing? What are you presenting here that's going to be published in JACC?
Actually, this is a summary of TAVR patients from 2011, 12, and 13. These 16,000 patients, and 70% got a transfemoral and 30% a transapical approach. And we looked at the overall outcomes, which are basically very good in relation to a high risk profile, 81 years, SDS score between 5 and 7, and the Euro score around 20 on average. We have an overall mortality of 5%. But in addition, we looked at severe vital complications, at technical complications, at need for sternotomy of these procedures, did some multivariate assessment of those outcomes and of predictors for those outcomes.
Any surprises in the data?
Well, there's a few kind of, not surprises, things we had expected, especially that there's a significant decrease in complication rates, but they're still substantial. So severe vital complications remain at 4%. If you have such a complication, you have still a 60% chance of survival if you're treated nicely in a heart team with cardiac surgery on site. Technical complications go significantly down, but there were, for example, no predictors for sternotomy. We cannot tell which patient will require sternotomy.
That was important. I saw that. It's like I wouldn't have necessarily projected that.
Well, it's difficult to project. We just felt we need to look at it, and actually it remains at 1.2%, no predictors, and this is a clear kind of result that leads us to the conclusion that a heart team should be there to treat those patients.
I mean, in the United States, and I suspect it's the same way in Germany, a heart team is really required. That's into the guidelines. It's like, it has to be a heart team-centered approach.
That's right, that's in the guidelines in Germany, but there's some sites who would treat patients by means of TAVR without a cardiac surgery on site, and therefore we in part looked at these data and really can conclude that a heart team is helpful because, again, those patients who have a severe complication can survive to 60%, which I believe it's worth it to take the effort.
So any take-home message that you want to get across at this point?
Well, the important message is that we have good outcomes in Germany with Gary, data from TAVR procedures in 16,000 patients. We have high survival rates, but of course some complications are still occurring at about 4%, severe vital complications and technical complications. That's why we need to treat patients in a good heart team.
Now, Gary is an active registry, correct?
Yes.
So it continues to gather data, so we will continue to see you and your colleagues for some time, I hope.
I hope so. Actually, we include full patient inclusion. We continue till the end of 2015. And then, of course, we need to have longer follow-up. So we're working on 3-year follow-up right now. Then we'll have 5-year follow-ups, etc.
Well, the Gary data is already online because it was published simultaneously with the presentation here at ACC 2015. So please look for that at JACC. And for Cardio Swiss World News, I'm Executive Editor Rick McGuire.